Hello, my name is Daniel Mulchand, and I'm a fourth year student majoring in health education and behavior. My poster is on the associations between neighborhood characteristics and cannabis use in truant adolescents. Neighborhood characteristics refers to the physical features of neighborhoods, such as the aesthetics of housing or recreational facilities, and the structural features of a neighborhood, such as crime rate or poverty. Neighborhood characteristics have been used to help explain the rates of mental health disorders, such as anxiety or depression, on vulnerable populations. However, this is yet to be done on cannabis use disorder in truant adolescents. Truancy is defined as having unexpected absences from school without permission from one's parent or the school, and has been linked to higher levels of drug and alcohol use in adolescents. Behavioral economics states that contextual factors, such as neighborhood characteristics, are related to substance use in this population. The purpose of this study was to investigate the relationship between cannabis use and truant adolescents. I hypothesized that negative neighborhood characteristics, such as lower walkability and higher crime rate, will be associated with higher rates of cannabis use in truant adolescents. Participants completed an online questionnaire on Qualtrics where they were asked a variety of questions including demographics, how many times they used cannabis in a typical month during the past school year, the DSM-5 cannabis use disorder criteria questions, and the Neighborhood Environment and Walkability Scale for Youth, or NEWS-Y measure. The NEWS-Y measure is a measure composed of different subscales, with each subscale representing a certain neighborhood characteristic. In this study, we used the subscales involving recreation facilities, walking or cycling facilities, neighborhood aesthetics, and crime. The recreation facility subscale was a 14-item questionnaire that asked participants how far away they perceived those recreational facilities to be on a scale ranging from 1, meaning 1 to 5 minutes away, to 5, meaning 31 minutes or longer. The three remaining subscales totaled 13 items, and participants were asked how much they agreed to the statements on a Likert scale ranging from 1, strongly disagree, to 4, strongly agree. Participants were 13 to 17 years old and reported at least 5 unexcused absences from school in 90 days. Of our 52 responses, 34 adolescents were cannabis using. Persons correlations found little correlation between the cannabis using questions and the NEWS-Y subscales. The reasons for this could be due to the small sample size, the potential lack of variability in the neighborhood characteristics of truant adolescents, or due to changes in the legal climate surrounding cannabis and increased access to and use of cannabis among youth. Neighborhood characteristics may have little influence on their cannabis use. Future work will include similar procedures, but with a larger sample size, and comparing truant versus non-truant cannabis-using adolescents in order to establish a correlation between neighborhood characteristics, truancy, and cannabis use.